At the base of a mountain, two paths diverge, each leading up to the summit. And although both require experience and have countless obstacles along the way, the path on the right is a much simpler, easier alternative, whereas the path on the left is steeper and the obstacles are more complex and difficult to overcome. So, when faced with this dilemma, which path do you take? It should be a simple choice, right? The path on the right will get you to your goal a lot quicker and with minimal risks. Yet, what if I told you that only people that meet a specific criteria can take that path? Seems a little unfair, doesn't it? And although this is a completely hypothetical situation, it isn't too far from the unfortunate reality that many people desiring to go into medicine will face. On its own, the medical field is already challenging. In order to excel, it requires hours upon hours of intense studying and years of experience and dedication. And despite all of this, some will always have it easier than others. In the United States, there has always been a very large wealth gap, and to this day, that division continues to grow, causing a lot of issues for lower-income Americans. Over 75% of medical students come from the top 15% of the highest-earning households in the United States, whereas middle and lower-income Americans make up only 25%, meaning these groups are heavily underrepresented in the medical field, and this is often due to the fact that many cannot afford to pay for university. Since 2001, tuition rates have skyrocketed 144%, compared to the average American salary, which has only risen 18% since that same year, meaning that it is harder to pay for university now than it was 20 years ago, leaving lower income families even more disadvantaged now than they were before. The problem, however, starts even before one applies for college. Public schools in impoverished areas such as many inner cities are often underfunded, on average seeing $2,100 less per student than their suburban counterparts and $4,000 less than those taking part in remote online learning. Despite all of this, cuts continue to be made, and in 2020, amidst the coronavirus pandemic, an additional $5.6 billion were cut from the U.S. Department of Education's budget. This only adds to problems facing lower-income students. Because of lack of funds, their schools cannot offer as many extracurriculars and opportunities for their students, which are vital for when applying to colleges, as the schools in wealthier areas can. When going into a field like medicine, for example, mentorships and internships are incredibly important because they can be a big help with getting into college and create familiarity in what seems like a daunting field. And most wealthy students have access to this. Unfortunately, most others do not. Even so, parents will hold out the hope that their child's tuition will be paid through athletic and academic scholarships when the odds are against them in this case as well. Only 1.5% of students will receive full ride scholarships, and not even 20% will receive enough money to cover even half of their tuition. Another group heavily affected is women, and when considering to become a medical professional, they often have to think about what they could face if they choose to continue down the path. Medicine is a traditionally male-dominated field, with around 64% of physicians being men. However, when looking at higher-level specializations, that disparity increases significantly. For example, only 4.5% of interventional cardiologists are women. They make up only 7.8% of neurological surgeons and 5% of orthopedic surgeons. And because of this, microaggressions towards women are incredibly common. And women are often stigmatized for pursuing a career instead of starting a family. And then when they want to start a family, they are ostracized for that as well. Additionally, women tend to earn less than men do for the same job. Male specialists on average earn $372,000, whereas their female counterparts earn $92,000 or 25% less. The fact that this issue is often brushed off as they don't work as hard or they aren't as good as their jobs as men are, it really is no wonder why so many women decide against pursuing a career in medicine, even if that's where their hearts lie. Due to the exclusion of these demographics in the medical field, they tend to be misrepresented. For example, because women are often excluded from clinical research and most research is conducted by men, the disparities between the male and female organisms are too often disregarded. Because of this, women are 50% more likely than men to receive a misdiagnosis. Other times, women seeking diagnoses are often told by doctors that their symptoms are all in their heads or caused by hormones, which leads a lot of women to distrust doctors. If more women are able to partake in clinical research and become physicians, they can help close this gap because they will create a better understanding of the female body and its needs. Many people of a lower socioeconomic status often distrust doctors, and their reasoning for it is often justified as well. They will be prescribed more generic medicine for their conditions, and often doctors will avoid giving them referrals for specialty care because they are often stereotyped to be non-compliant, less intelligent, and more irresponsible than their wealthier counterparts. Because of this, they often don't receive the same medication that they need, or the advice that they do receive from medical professionals doesn't work as well as it should. And those who have financial struggles, the availability of money will always have a significant impact on decision making, and many, when forced to make the difficult choice between getting help or paying their bills, choose the latter, because when weighing out their options, they feel that going to the hospital isn't worth the risk of going into debt, especially when there is the belief that they won't receive the adequate help. However, if more people who grew up in a similar background join the field, they can help ease this problem. A physician that is knowledgeable on the situation and experiences of their patients is better equipped to make decisions for them, if not only will help rebuild the trust, but also improve overall health of the people living in our country. The vitality of the inclusion of underrepresented groups lies in understanding. Women are better suited to make decisions regarding the female body than anybody else because of their understanding and experience, which is something heavily preached in the medical field. People coming from a low-income background have more knowledge on the issues concerning those living in poverty because they have also experienced it. Through inclusiveness, medical professionals have the potential to better accommodate everybody, not just a select group of people, especially in a field with such a gross impact on people's lives and well-being. In order to unlock this potential, we need to incorporate a more diverse population into medicine. However, this cannot be attained until the prominent issues that these groups face are resolved. For women, things like microaggressions, stereotypes, unequal treatment, and pay need to be addressed so more women feel comfortable joining the field. In lower income areas, it is vital that schools receive better funding so that their kids have more opportunities to further their education. These changes cannot be made overnight, but progress continues to be made, and it is important to contribute to bring attention to these issues so that the potential that these groups carry can be utilized to help the medical field continue to take strides in the right direction. Thank you.